We've all had a cough, a runny nose, or a fever at some point. But how do you know if it's RSV, COVID-19, the flu, or just a common cold? Let's break it down in a simple way. First, let's look at what causes each of these illnesses. RSV is caused by the Respiratory Syncytial Virus. COVID-19 is caused by the SARS-CoV-2 virus. The common cold is usually caused by rhinoviruses, and the flu is caused by influenza A or B viruses. Now, let's look at the symptoms. While they may seem similar, there are some key differences. So, who is most at risk of getting these viruses? RSV is most dangerous for infants, the elderly, and those with weak immune systems. COVID-19 can affect anyone, but is more severe for older adults and people with underlying health conditions. The common cold is usually mild and can affect all age groups. And the flu can be dangerous for young children, pregnant women, the elderly, and people with chronic health conditions. What can we do for prevention? RSV spreads through droplets and contact with contaminated surfaces. There is no vaccine available except for high-risk infants. COVID-19 spreads through airborne particles and contact. The good news is that vaccines are available. The common cold spreads easily through droplets and touch, but unfortunately there is no vaccine currently. And the flu spreads through droplets, and annual flu vaccines can help prevent severe illness. So, how do we treat these illnesses? RSV can require supportive care and even oxygen therapy in severe cases. For COVID-19, rest, hydration, and for severe cases, antivirals can be used. For the common cold, rest, hydration, and symptom management is required. For the flu, rest, hydration, and for severe cases, antiviral medications can be used. So, next time you or a loved one gets sick, you'll have a better idea of what might be causing it. Stay informed, stay safe, and take care. We hope you found the information in this video useful.
What does viral load mean? This means the number of virus particles inside your body. When you become infected with a virus, if the number of particles and their replication is very high in your body, this is known as high viral load. If the number of particles and their replication is low, this is known as low viral load. What is viral shedding? People who are infected can spread or shed the virus to their outside surroundings. This is certainly the case with flu viruses and coronavirus. People with a high viral load will shed more virus particles than people with a low viral load. Evidence also shows that people with a high viral load tend to experience more tougher to severe symptoms than people with a low viral load. This is why viral load is considered very important, as medical experts know this can determine a person's symptoms, recovery, and spreading power of the virus. It is also important to note here that people with a high viral load can sometimes exhibit no symptoms but can spread the virus they are infected with. Therefore, ways to reduce viral load are advised, such as regular hygiene practices. This will help prevent your body from ingesting more virus particles. Social distancing. This will help reduce your exposure to virus particles that may be being shed by infected individuals. And wearing protective clothing such as face masks and PPE. We hope you found the information in this video useful.
The cold and flu are two common illnesses that often get confused, but there's a difference between the two, so let's talk about them. The common cold is usually milder than the flu. Symptoms include a runny or stuffy nose, sore throat, and cough. Most people recover within a week without any complications. On the other hand, the flu can be severe and even deadly. Symptoms include fever, body aches, and fatigue. But how do you know if it's a cold or the flu? Well, the flu hits you suddenly and hits hard, whereas a cold comes on gradually and is less severe. Remember, prevention is always better than cure. So during the flu season, make sure you're washing your hands regularly. You can also cover your mouth and nose when traveling, and you can get vaccinated. I hope you found the information in this video useful.